Hello and welcome to this evening's webinar. My name is Hannah Dyson from Enfield Voices and Global Net 21, and this is one of the many webinars that we do each week exploring various topics. And today and this evening, we are very proud to say that we have Anuka Gazara-Anthony today on the webinar talking about the topic of mindfulness and hypnobirthing in COVID birthing environments. In this webinar, we will explore how mindfulness and hypnobirthing can empower parents with anxiety and fear in COVID birthing environments. We also will discuss how and why language and narrative surrounding pregnancy, birth, and postnatally and in the workplace can have an effect on outcomes for parents, entire families, society, and the world. We will explore mindfulness in the workplace, and in particular in leadership, and how this can influence employees at work and at home. So welcome, Anuka. Hello, and welcome to the webinar. Thank you for agreeing to talk to us this evening about your experiences. Can you start off by telling us about yourself and your background?
Yes, well, hi, Hannah. Thank you so much for inviting me. Really happy to be here with you and all your followers this evening in the UK time, this afternoon here in the East Coast. So hi everyone, my name is Nuka Gazara-Anthony. I am born and raised in Enfield, but currently living here in Washington, DC. And I'm a childbirth educator, as well as a hypnobirthing practitioner and a mindfulness and emotional intelligence consultant. And so I spend a lot of my time either working with new parents, with preparing them for birth throughout the pregnancy. I also support businesses and institutions with mindfulness and emotional intelligence webinars and trainings to really help staff that are really suffering, especially right now during COVID, with burnout, and giving them the ability to cultivate a better approach towards stress management using mindfulness and emotional intelligence tools. So that's a little bit about me, but predominantly my work is actually working with new parents and childbirth educators.
Fantastic. That sounds like you're very, very busy actually over there in Washington where you live. Can you tell us a bit about the first time that you kind of were introduced to mindfulness and hypnobirthing? What were the circumstances surrounding that?
Absolutely. So with hypnobirthing, actually, when I gave birth to my first child 7 years ago, I actually didn't do any childbirth education. I just assumed that, I eat reasonably well, I exercise, I do yoga, it should all be fine. And unfortunately, which some of you may be aware of, that as human beings, when we find ourselves in a very threatening or fearful situation, what the brain does, our prefrontal cortex, which is just behind our forehead, it makes that decision of, are we going to fight the situation or are we going to flee from it? And for me, going into the hospital environment, which I hadn't done the hospital tour, so I wasn't really sure about what it looked like or what facilities would be available to me, that experience really ignited that freeze reaction in me. And what happens is in birth, that when birthing mother freezes, the most important muscle that we need to be able to breathe and birth our babies is the uterus. But if we're in that freeze position, the whole body is constricted, and in particular, the uterus is completely constricted, depleted of oxygen and blood that rises to our brain so that our brain can decide, okay, what are we going to do next in order to survive? So in a birthing situation, and what happened in my experience is that when my uterus froze, the whole birthing transition and labor actually kind of stalls, and the birth rests and nothing really happens. All your contractions cease, and you can become very nervous because now perhaps the doctor, which was in my case, maybe telling you, well, nothing's really happening. Maybe we should just go and do a C-section after a period of a long duration. And that can sometimes create even more fear for mum. Unfortunately for me, this led to me not only tearing to a 4th degree, but I also needed an episectomy, which is where some of you may know the physician physically widens the cervix in order for you to birth a baby. And so these two physiological reactions towards birth was extremely traumatic for me. It also provided complications in afterbirth with breastfeeding as well. And so I was really, really determined when I got pregnant again with our 2nd child, that I wouldn't want to have this kind of experience again. And I really wanted to empower myself with support and knowledge about how it is that women can be able to give birth in a much more calmer way. And I think looking back at it now, I think it was partly my way of really reflecting on the trauma of the experience, where 6 months after I gave birth, I actually came back to the UK because 2 of my friends had given birth, one in a hospital and one at home. And they both had these really wonderful, joyous, calming experiences. And they had both done hypnobirthing. And so I was just really intrigued by it. So I came back to the UK. I did the program in Enfield, actually, really loved it, trained in it a year later, and I've been teaching it for the last 6 years. And I renewed my training here in the US as well. So it's really, when it came to me delivering the 2nd time around, it was like a night and day experience, completely different. I felt much more relaxed, so much more knowledgeable about what my body is going through, what can I expect, how can I manage if things change, how do I adapt, how can I get my partner involved in the birth, which, you know, we just didn't prepare ourselves the first time. So he really wasn't sure how he could support me the way I needed to be supported with our first birth. So it was really transformational for me having a hypno baby. And it's really given me the ambition and the determination to really teach this program to new parents and birthing parents around the world.
Yeah, because I think your birth experience, especially during COVID, can have a long-term influence on how you bond with your baby and your life, you know, in the years coming in the future. So it's very, very important. Could you tell us a little bit about do you think anxiety can have long-term consequences for the parents and baby, and a little bit about that?
So before I talk about anxiety per se, just in case you have some viewers that are curious who may not be so familiar with the hypnobirthing program, with hypnobirthing, it's really a program that's designed to prepare birthing mother and partner with that mind-body connection so that they can manage any anxiety or fear that may be arising throughout the pregnancy and prepare them to manage any uncertainty that may develop during the birth. And it might be also interesting for your listeners to know that in the UK, 1 in 4 women have cesareans, and in the US, according to the CDC, for mothers over 50%, it's 48%. Sorry, mothers over 40 years of age have a 48% higher chance of having a C-section for their births. And what we find is that it's not necessarily because there are special health concerns or circumstances that have developed during the pregnancy that have caused the birthing mothers to choose a C-section. It's also because of sometimes birthing mothers experiencing or feeling very anxious about giving birth. And so hypnobirthing is more than just preparing you physiologically for the birth. It's actually empowering birthing mother and partner with tools and practices to really help you manage the anxieties that may be arising throughout the pregnancy or even beforehand. Because what we have also noticed, especially during COVID times, is that because we are all constantly on devices, we're constantly, listening to the news for updates, we're reading articles, we're listening to podcasts. Sometimes what we listen to, what we read, is also creating this heightened emotional response towards birth. And we might not necessarily always be conscious of it, because some of that can just, dive into the subconscious. So we're not really aware of it in our everyday routine. But what we've noticed is that when mothers then become pregnant and they're, now learning the constant updated procedures of COVID, especially at hospitals, that these kind of experiences can also increase anxiety. And so having a program that you can actually start with from the beginning of your pregnancy with a partner or someone that you choose to be with you during your birth can be so empowering in not only shifting that mindset of fear to more confidence and empowerment, but also with giving you practices and tools to manage your own anxiety in life, whether it be also in your professional work and in your home life as well. And I think that's one of the key elements of hypnobirthing, is that we're really giving new parents a gift, like a toolbox of tools and practices that they can also use beyond their birth, just as becoming new parents. And also some of my parents throughout the years have really utilized the different breathing techniques, for example, when they are facing difficulty or moments of overwhelm in their professional lives. So with hypnobirthing, we're really giving new parents a whole spectrum of tools for anxiety for every phase of their life, also beyond the birth itself.
The right language is important during pregnancy, maybe at the start of the pregnancy and during your sort of antenatal appointments. Do you think, I know that you live in the US, but if you think about antenatal care in the UK, do you think healthcare professionals should change language right at the start of their antenatal care and throughout, and maybe even postnatally as well? What do you think about that?
Absolutely, Hannah. I mean, I have been learning, studying, working with mindfulness over the last 20 years. And what we have seen is that, especially through mindfulness work, research that focuses on neuroplasticity, which basically shows us that what we say, how we think, and what we do literally changes the structure and function of our brain. So if you are constantly visiting your obstetrician and they're telling you from, week one, oh, labor can be really long, it can be really strenuous, you've got a busy job, why don't we just book you in with a C-section, and that way you have it all planned? That's already implanting seeds of doubt and fear in a birthing mother's mindset. And so over a 9-month or so duration, that can really cultivate a very, very strong negative reaction towards birth. And physiologically, that can also manifest in mothers choosing not to have a vaginal birth just because of the immense perception of what they believe the birth could be in terms of pain.
Well, I know a lot of my friends have said when they're trying to breastfeed, when they bring the baby home, there's a kind of negative sense right from the start, even before they can watch, when I think the health care assistants watch you breastfeed. Do you think, there should be more of a positivity, and how can mindfulness help that?
Absolutely. I think that, we are all wired for connection. Yes, it's great to be independent and self-reliant, but ultimately our brains are wired to be interconnected with another person, another human being. And so if we can cultivate experiences, especially throughout the early part of the pregnancy, so you can really give yourself time to develop it, where you're working with a doula or a midwife or a childbirth educator, and you're doing practices of mindfulness, which, by the way, in case some of your viewers are not quite sure about what mindfulness is, the simple definition of mindfulness is just being aware of the present moment, but in a non-reactive, non-judgmental way. That's the simplest definition of mindfulness. So mindfulness is not just about meditating. It can also be an integrated experience where you're just taking a moment a day to just maybe notice your feet on the ground. Or maybe as you drink that cup of tea, you're just really noticing how drinking that cup really feels good and nurturing towards your body. So just being more aware of that present moment. And when we look at that in a birth context, especially now during a global pandemic, I really believe that giving new parents that opportunity to learn some of these integrated, but as well as the dedicated practices, which can be like a guided meditation, to really empower them throughout that pregnancy journey, can be tremendously important to not only the birth, but also to our psychological well-being, our overall health and growth. I mean, I'm sure some of your friends and viewers tonight are also balancing new responsibilities, right? Some people may be working from home. People may be working with children also at home, or taking on extra care responsibilities as they're working from home. And so that can really increase the stress and the burdens of what we're doing in our everyday lives. So having access to these kinds of practices can be extremely transformational in really helping you respond better, having a more calmer, balanced mindset, and also really working towards having a greater overall well-being as well.
I wonder, what do you think, Anuka, about I don't know if you know, but in the UK during COVID, if you're just having your antenatal appointment, you have to go in on your own. So if your 12-week scan, your 20-week scan, and any sort of other appointments, you might have to go in just because of the infection control risk. What do you think about that policy? Do you think it's time for it to be changed now?
With my experience and my research, I really feel that, especially if you're a new mother, having the option to bring your partner or someone that you trust and want to have as part of your birthing experience can be tremendously important to your overall psychological well-being throughout your pregnancy. And to go into an office alone and feeling already quite nervous about going into perhaps a hospital environment because of this pandemic, and not having anyone that you can share that experience with, I think that can be really overwhelming. So yes, I really agree with you, Hannah. I really think that policy should be overturned, and we should really start integrating much more compassion and kindness with new parents, and not just expecting them to just, keep calm and carry on. I don't think that phrase is really conducive to ensuring a stronger and positive mindset and well-being for birthing mothers. And I want to share with you actually some research I was looking back. So, I was telling you earlier about my fight-flight reaction with my own birth. It's really interesting because that term was actually coined by a doctor in the 1930s called Walter Cannon. And it's really interesting is that he was looking into how human beings respond to stress. But when he was doing the research, he was only using men. And so it wasn't until 2008 where a doctor called Shelley Taylor at UCLA was then starting to look at, but how do women actually connect to stress responses? Because it's not always that fight or flight reaction for many women. And what she said through her research is that for so many women actually react to stress or fear in this tend and befriend phase. So what does that mean? It means that we take the time to really express how we're feeling, being a bit vulnerable, and then finding common ground when we find ourselves in a stressful or overwhelming moment. And I think if we look at the research, especially when we're talking about birthing mothers, we need to appreciate that some birthing mothers will require further assistance and support, especially in those antenatal classes or those antenatal visits throughout the early part of the pregnancy.
Family and like support is a big issue. I don't know if it is in America possibly as well, because everybody's living in their different houses. And I know you're kind of very culturally aware. Do you think if you look at places like some places in Africa and different sort of cultures in different countries where families are more together, they might be living in one big house or one big small town or small village, do you think that they should sort of bear that in mind a bit more when thinking about policy, like maternity policy and parental policy going forward?
Absolutely. You know, we come like our ancestral parents and families and all come from this mindset of a community, right? Of a tribe. That's how we survived. And unfortunately, especially we see this in the West, that because our lives have become so much more busier, the pace of life can be a lot more strenuous, our responsibilities are more heightened, we lose our tribe. And so I think the COVID environment has really personified how difficult it can be for some new parents who don't have access to family or that's nearby, and how being able to provide them with a supportive network, perhaps like introducing them to parents that live nearby, and their ability to just see each other, you know, in a socially distanced way, or have a FaceTime chat or whatever it may be. Those kind of experiences can really foster and cultivate that, you know, community vibe and that support network that especially I believe new parents will benefit from. Because if we know that we have, especially we see through the research with women, that if we know we have the ability to be with someone that we can trust, to share, you know, our most deepest vulnerabilities, then we're far more able to then shift our mindset into a more psychologically positive framework if we are experiencing very negative feelings of being alone or depressed. We see it actually with the hypnobirthing. When we did some research on post-birth data, we've noticed that with hypnobirthing, there's actually less likely chance of hypnobirthing parents, especially hypnobirthing mothers, experiencing postnatal depression. And that's partly because the program really encourages trying to communicate and be open with your own awareness of how you're feeling. And by managing that, some of the practices that also includes is language. Like, how do we talk to each other? And when you don't feel heard by your partner, what can you do about that in a much more sustainable way? So I actually really agree with you. I think there needs to be some much more awareness and policy when it comes to allowing new parents to communicate and be with, you know, actually in a physical way, but probably in a social distance way right now, but had the opportunity to speak to others that are going through the same journey.
But I think hypnobirthing and mindfulness, as you say, can empower mums and dads, and parents. And yeah, because I think if you have a negative experience, that makes you feel like not very empowered, and I think that's sort of the trauma in a way, or part of the trauma. Could you tell us a little bit more about how you use your combination of business and mindfulness skills to your work as a leadership coach? Can you tell us a bit more about that and how you're helping if you're working with companies and things like that?
So I've been really fortunate and privileged to partner with a friend and colleague who has a business called Inseus Mindfulness. That's INSEUS. And what we've done is that we've been working in particular also with nonprofits, and we're currently working with some sectors in the US government to offer emotional intelligence and mindfulness practices that we have actually have research on that really empower professionals in particular with cultivating a stronger focus and motivation and performance with their work using mindfulness practices and tools. And one of the programs that we actually teach is called Search Inside Yourself. We are both trained at the Search Inside Yourself Leadership Institute. And this was a program that was born at Google around 12 years ago. And it was originally designed for engineers at Google who were suffering from really extreme burnout and fatigue. And so the founder, Chad Meng Tang, he basically got together the most prominent researchers in the field in neuroscience, in emotional intelligence, in mindfulness. We integrated a lot of teachings and techniques from a very famous mindfulness teacher, both here and in the world, Jon Kabat-Zinn, who actually started the first medically recognized mindfulness stress reduction based program in the healthcare system here in the US. And so with this program, we're offering the ability for professionals, and also we also work with executives as well, to really look at emotional intelligence and understand why is it that it's important for us to first have that first foundation of emotional intelligence and be aware of that, which is self-awareness, and how does that impact us in our ability to connect with each other, learn with each other, work with each other, and ultimately grow our businesses and our roles as well as influencers and as leaders. And so we have found through our own research as well that this particular program has been really effective and transformative for many people who are just struggling to really find motivation amongst the increase of stress and responsibilities within their work and also in the external environment. Just having access to these tools and practices has really been an empowering journey for them.
Confidence is so important. But yeah, we're kind of coming to the end of this webinar now, and the time goes so fast when we do these webinars. So I'd like to thank you, Anuka, for explaining a little bit about your work. I feel like we've only touched the surface, but yeah, we can see how much you do, and it's so interesting to talk about your work. And yeah, I'd like to thank you very much for participating in this webinar. If people want to know a bit more about mindfulness, hypnobirthing, to do with parents, or in regard to sort of leadership coaching, how are they best to contact you?
Yeah, sure. Well, first of all, just thank you so much. Like, I've just really enjoyed this, and it's been an absolute pleasure being with you tonight, Hannah. And if you're curious about learning more about mindfulness, or just intrigued about what programs may be available for you, for your teams, for your businesses, I really recommend that you check out our website. It's www.inseus.com. And we also have a library of free resources, information, some guided meditation practices that you can also download for free. And if you're curious about childbirth education, hypnobirthing, and I also offer many bespoke birthing and breathing programs, please check me out at janujoyfulservices.com, or you can have a look at my Instagram handle, which is at janujoyful, JANUJOYFUL.
Fantastic, thank you. I'm going to check that out myself. Yeah, so thank you for that information, and it's been great chatting to you today, Anuka, and we'll end this webinar now.